Good morning, students. Today we'll be discussing about the spleen. Now, what is spleen? Spleen is the largest lymphoid organ. Where is it present? Location. It is present in the left hypochondrium. What is the shape? It is ovoid shape. Some describe as wedge shape, but you can see it is ovoid shape. Okay. Now, what is the color in living person? It is deep purple in color. It is deep purple in color. Now, how do we hold the spleen in anatomical position? Okay, now there are three fingers I am using. Where there is a 9, there is a 10, and there is a 11. Now these three fingers represent the three ribs, 9, 10, and 11 ribs. So I hold it like this. I hold it like this. Now this is how I hold it in anatomical position, because this is how the spleen is present in our body. Okay, it is present in such a way that it is coinciding with the long axis of the 10th rib. So the long axis of the spleen is along the long axis of the 10th rib. That is how you hold the spleen in anatomical position. Okay, now the spleen has got basically two surfaces. You can see one smooth convex surface. Now this surface is the diaphragmatic surface because it is in contact with the diaphragm. Then there is one more surface here, what you are seeing here. Now this is the visceral surface. There are a lot of impressions. The impressions are produced because of its relation with the various viscera. Okay, now the first impression what you are seeing here, now this is the gastric impression. This is the largest impression. This is the gastric impression. The fundus of the stomach is in contact with this impression. Then you see a triangular impression here. Now this is the colic impression where you have the splenic flexure. The splenic flexure of the colon is in relation with the splenic colic area. Then you have the renal area where you have the kidney which is in relation to this part. Okay, so this is known as the renal impression. Which kidney? The left side. So left kidney is in relation to this part. Okay, now coming to the borders, you got three borders. You got a superior border which is notched. You can see the notching here. You can see the notching here very clearly. The notching. Superior border. This is the intermediate border, and this is the inferior border. Okay, so three borders are there. Now that there are two ends, that is the anterior end and this is the posterior end. I told you, you hold the spleen like this. So this will be the anterior end, this is the posterior end. The posterior end is thick and narrow, whereas the anterior end is broad and it is sharp. And sometimes some authors describe the anterior end as anterior border, but it is not anterior border, it is anterior end. So this is anterior end and this is the posterior end. So this is how you hold the spleen in anatomical position. Now, above the intermediate border, you have the hilum of the spleen. So in the hilum of the spleen, there are two ligaments in relation. Now one first ligament above the hilum, the first ligament just below the gastric impression, this is the gastrosplenic ligament. Now gastrosplenic ligament, you have the short gastric vessels inside. Then you have one more ligament below that, that is the lineorenal ligament coming from the kidney. Now this ligament will contain the tail of the pancreas and the splenic vessels, that is the splenic artery and the vein. So this is with the spleen. Thank you.